Okay, good. Then we can get started, guys. Man, this is the first Saturday we've been able to do for 2024. Super exciting. It's been, we're getting real busy right now with people enrolling and signing up. It's been super exciting, and just the growth and recognition with what this program is doing has just been, it's been really exciting to see, and it's spreading. The word is spreading around right now. I think the podcast that I finally started, much anticipation, guys. Please follow the podcast, by the way. We're on YouTube, is like always the best place to follow, but I'm on Spotify and Apple too as well. And my goal with the podcast is always, as everything, lasting weight loss, hence the name Lasting Weight Loss Podcast with Dr. Jones, but really focusing GLP medication and big picture. How do we lose this weight? How do we use science-backed options, and how do we get off and maintain it for the rest of our lives, right? That's what I'm most passionate about. Okay, so let's get in to some coaching, guys. Let's see. So let's start with reintroducing carbohydrates during flow. As you guys know, with this program, the recommendation for the dietary approach is a keto version of Paleo-Mediterranean, right? That's the general boiled down nutritional approach. And we talk about keto for the first 2 months. So there is no textbook. 2 months is a range. You certainly can go longer if you're really enjoying it, if you're really liking it, if you're getting some additional benefits that you think are related to the keto, or if you start reintroducing carbs and you just feel really bad, then you can always slip back into keto for longer. But generally speaking, 2 months is a good amount of time when the program's going smooth, when you can see the week by week trends. You're losing about 1% to 1.5%. You're fasting for 48 hours per week. That's the most important thing. Do not transit out of keto if you are not fasting for at least the 36 to 48 hours per week. That's a must. So that's my caveat to this. But if you took about 2 to 3 weeks to get into the long format fasting, and now you're at about month 2 in the program, and all those things that we just talked about, things are going great, that's when you want to start reintroducing carbohydrates back into the program, or back into your diet, right? Back into your lifestyle. How do we do that? How do we approach? Generally speaking, we want to slowly reintroduce the carbohydrates back. Now, this relates to other videos that you've seen me, or that if you haven't seen them, I would recommend you watch them on FLOA University. Carb cycling, keto cycling is very relevant, because the perfect scenario would be to transition from a keto, right, still focusing on unprocessed Paleo-Mediterranean, into that cyclic keto. So there's so many ways to do cycling keto, which is why you should watch that video. But my favorite way to cycle keto is carbs on your weightlifting days and keto on your non-weightlifting days. So if you're lifting, I lift 3 days a week, guys. So perfect scenario is I'm eating carbs 3 days a week, maybe the day before, so 4 days. And then I try my best to go keto on the other days, and I'm usually fasting for my long fast in those other non-carb days as well. Ideally, you transition into this cyclic keto and keep yourself on the low carb keto approach on those non-lifting days. That would be the best, most ideal way to approach this. Although the reason why I say watch that video is because there's other ways to cycle your keto. You could also go straight to carbs every day. There's always the best way to do it, and then there's other options and you guys should know by now, as long as your weight loss is still coming and we're doing the right things, I'm happy with what you're doing. But I would recommend that we go towards that keto 2 months into a cyclic keto approach on your lifting days. And it's that simple, guys. You don't need to overthink it. A couple key points to keep in mind is we're not going to go blasting high carbs like that. Don't do that, right? If you have a cheat day, if you have a bad day, if you fall off the bandwagon, then that's totally a different story. But as far as your general routine, you're going to go from keto to moderate carb, right? And the type of carbohydrates that we want to focus on, of course, fall within our category of healthy, lower processed carbohydrates. So we can start reintroducing those fruits, quinoas, some of those whole grains. We can start incorporating that and trying to stay away from the processed carbohydrates. Again, shouldn't be a shock or a surprise that we want to still focus on the cleaner sources, but the key is, can we reintroduce the carbohydrates and still achieve weight loss? And maybe even feel better. Maybe the weight slows down a little bit, the loss, but you start noticing that you're getting stronger in the gym. You start putting on muscle mass like really fast. This is a good thing, right? If your weight loss rate slows down, but you start noticing you're getting stronger or your clothes keep dropping sizes while the weight is slowing down, that's a good thing. That means the ratio of fat to muscle changes are optimizing in our favor. That could happen for a couple weeks. Stay at it. Stay following the FLOA protocol, and you'll transition back to that rate that we want, which is 1 to 1.5% of body weight. We definitely do not need to overcomplicate this topic, and we don't need to make it harder than it is, because it's not. It's a simple thing, and it's important to do. All right. Jennifer, as we've talked about, remember, there is always going to be exceptions. And as I've stated to you, you definitely are a little bit on that lighter side of 1%. And so for you, what's going to cause an alarm for me is if your rate continues to decrease. If that weekly weight percentage keeps decreasing, that's where I'm going to be concerned. Otherwise, if your percentage stays consistent, that's where your body's at, and I'm actually good with the weight that you're losing because of all the benefits and changes that we're making. Remember, Jennifer, this is so much more than a weight loss program. This is about weight loss and being able to maintain the weight loss for the rest of your life. Okay, Erica, so if I'm trying to transition into training for bodybuilding involving 4 to 5 days a week, will that affect things tremendously? Interesting question, Erica. I haven't been asked that question, and I love the bodybuilding space. I'm an avid lifter, right? You guys can tell, but I don't work with that many bodybuilding patients, although I'd love to. Give me a little bit more context for that question, Erica, so I can actually do a better job replying to that question. I think you're saying, are you referring to you've already hit your weight loss goal, or I guess that's my main question. Have you already hit your weight loss goal, or did you start this program at a good weight, but you're looking to recomp and change your body fat percentage? Let me know. Gotcha. Yes, I understand that's how you train. You are just starting flow. So what is your primary goal, Erica? Is it to drop a bunch of weight, or is it to really drop body fat percentage and maintain as much muscle mass as possible? I'm guessing that's your goal because you're bodybuilding, so muscle mass is a bigger deal to you. So you don't care about the scale, you care about the body composition and that changing favorably. Let me know if that's what recomp. Okay. Now with your recomp, Erica, you still need to choose a primary goal. Is your primary goal dropping? Yeah, there you go. Okay, you beat me to it. Dropping body fat percentage and maintaining muscle mass. Fantastic. This will be the best format, Erica, and I tell you, bodybuilders would be, they'll never buy into this, but this is so much better for you, and it's so much easier for you to drop body fat and maintain muscle mass. So in this particular case, we're going to start a short little topic here for builders who are starting flow. So a bodybuilder looking to recomp when starting the FLOA protocol. In this particular situation, we can't use the metrics of weight loss per week as much because you are looking to maintain as much muscle mass as possible. If you are looking to recomp starting as a bodybuilder, or that's just a really important, you don't have as much body fat as a standard FLOA protocol person, then we really need to use other metrics for success. If you have methods of body fat analysis, I'm not a big fan of most methods, but you're going to have to rely on that, rely on pictures, rely on the way clothes fit. We're going to have to figure out different metrics for being able to quantify and assess that we are successfully dropping body fat week to week. And in this case, maybe 48 every single week might be a little bit too much. I would go through stage 1 of fasting, stage 2 of fasting, 24-hour, twice a week. And I would probably maybe play around with the lighter version of the flow stage. So the flow stage is 48 hours every single week. But for this particular scenario, you could play between the 24 hours a week and maybe 136. And I wouldn't go past 36. And I would assess how your body's responding and make adjustments. If you feel like no muscle mass is losing and you want to increase your fat loss, then you can start to increase that fasting window. The more fasting you do, the more body fat loss you're going to get. That's how I would approach it. Everything else is going to stay the same for a bodybuilder. Obviously, your protein goal is going to be even more important than anybody else. Probably higher than your target weight. Somewhere probably around your current weight in grams of protein is probably what I would shoot for. And then, of course, you're going to be lifting 5 days a week, 6 days a week, as opposed to my traditional 3. And that's where I would start and assess it from there. I would still go keto for at least 2 to 3 weeks as the bodybuilder. And the reason why I say that is because we're looking for maximum insulin resensitization. And I know when you go keto, it sucks, especially as a bodybuilder, because your muscles get really flat. Hopefully you're very familiar with that process so you don't get upset when you think you're shrinking. You have to remember this: the moment you fast for 48 hours or the moment you go keto for a week, your muscles shrink. You just have to understand that. And the moment you eat carbs, you blow up again. So as long as you remember that, don't freak out. But give me 2 to 3 weeks of keto, see how your body does, and then you can start transitioning into carbs around your lifting days and trying to have at least those 2 to 3 days of keto. So transitioning into a cyclic keto approach for you could be really good as well. And then I'll probably do some separate, more in-depth videos too as well, Erica. Guys, the question is, what are the macros for keto? I have really good in-depth videos on the keto in Flow University. The short answer is we don't have to worry about the macros. And to get the deeper answer, go check out the videos that I have on Flow University. All right. Okay, let's get to the next topic. So let's talk GLP-1 medication dosing. So GLP-1 medication dosing during the flow protocol for success. So you guys all know the dosing already from your welcome to form. It was discussed by the provider, but I want to make this video to talk about why we dose the way that we dose in the flow protocol, which is lower than what you will see most other clinics are doing, what most other obesity specialists would do. Dosing, tirzepatide. The upper dose is 15 milligrams. That's the highest dose that's considered still reasonably safe. And a lot of obesity specialists and a lot of primary carers and a lot of clinics just essentially have patients increase their dose until they get to the dose that they feel good at. Bottom line, right? Like, we're treating a disease called obesity, which the symptom is ravenous hunger. I can't stop eating. And so let's keep increasing your dose till you feel like the food chatter is shut off, right? This is the rhetoric. This is the approach that most people are taking. But guys, you have to remember why I am so much more careful, and also why most of my patients don't have to go that high. Number one, the reason why we don't want to go as high is because when we look at weight loss as a whole, not even weight loss from medications, weight loss from GLP-1 medications, weight loss as a whole, guys, if you didn't already know this, there's no research out there that shows any success of long-term weight maintenance with all measures of weight loss. And the method of weight loss that's been measured the most and studied the most is the calorie counting approach. But nonetheless, even the hormonal basis of obesity has even less research to support it. This is why it's controversial. But we have nothing to show that we have any sort of understanding of what works for long-term weight maintenance. And I think the staggering rates of obesity increase, we can see that, right? We know that we're failing, right? Obesity treatment. And so these medications are going to be the most powerful intervention if all we're thinking of obesity is getting our weight down. If that's all you care about, then these medications are the best treatment, hands down. But you guys are flow warriors, right? You didn't come to me. You didn't pay the extra money to just get weight loss. You could have bought this medication somewhere else for much cheaper. You came to me because you had the foresight to think, I want to be able to wean off the medications when I lose my weight. Understanding that it's going to cost you more money and it's going to cost you more effort, right? Because you probably have friends doing these medications that are like, oh man, I'll just take the medication and not even put any attention on it, because that's the reality, right? I just take the medication, food chatter decreases, and I live my life and I will lose weight because I'm eating less and and the drug is making me more sensitive to insulin again. So yeah, I'm going to lose weight. But now let's get into some more literature. As you guys all know already, 70% of people will regain all their weight 1 year after stopping their GLP-1 medications. That was a study done on semaglutide, tirzepatide, same deal. Massive and fast weight regain. I just talked to a patient the other day. I'm not going to disclose her name, but she regained, I think it was like 12 pounds within like 6 weeks of stopping, and she was freaking out. And she didn't follow my program. She didn't get into the rhythms of fasting. She didn't do the things that are actually treating the disease from an underlying lifestyle perspective. Because even the word treating is controversial. Right? What does treating mean? Get rid of, handle? If it takes a drug to handle it, did you fix it? Or did you artificially deal with it from the drug? That's a whole nother almost philosophical topic. And I don't want to digress too much. But nonetheless, what I'm preaching and what I'm doing and what we're doing in this group is we are addressing obesity, which I believe is a disease which has genetic and lifestyle contributions, with lifestyle interventions. And you guys know the flow fasting is the centerpiece, the most powerful. That's my bread and butter. That's my magic sauce of how we fix this disease, so that we can get to the point where we are at our weight loss goal. We are more insulin sensitive. Our inflammation is reduced. We're more metabolically flexible, right? So therefore, we can start to wean off the medications and not have the standard rebound of weight gain that everybody else is getting, okay? With all of that being said, let's get back to medication dosing. It goes without saying, but I'm going to say it anyways. The higher dose you get to, the harder it is going to be to wean off, period. Even with what we do and how we address the underlying issues causing the hunger, the higher the dose, the harder it's going to be to wean off. Not impossible, but harder. This is why the standard dosing in my program is the lowest dose that allows you to get into the flow protocol. Let that sink in. The lowest dose that will allow you to sink in into the flow protocol, the 48-hour weekly fasting. So that's the lowest dose. Now, 5 milligrams tends to be what works for most of my patients, which is a lot lower than most people, because I think of many reasons. Number one, the AOD is very powerful. It mobilizes body fat. It plays its own roles. And there's no literature of tirzepatide and AOD and what it's doing together. So I can only look at the mechanisms and look at the outcomes that I'm seeing and hypothesize. So I think it's the combination of everything that I'm doing with my patients. The AOD, the cycling keto approach, the lower inflammatory from the Mediterranean and paleo choices, the supplement protocol that I put you guys in to to ensure there's no nutrient deficiencies, the extra magnesium, the anti-inflammatory supplements. We do a lot in this program, guys. And I think that the combination of all of it is what's allowed